Most people believe that memory loss is simply a normal part of getting older, something you shake off with a joke about senior moments. But here is what many people do not realize. Ordinary forgetfulness and the early signs of dementia are not the same thing at all, and learning to tell them apart could make a real difference for you or someone you love. This video is for educational purposes only and is not intended to diagnose any condition or replace the guidance of a qualified healthcare professional. If anything in this video sounds familiar, the most important step is always a conversation with a doctor who knows your full health history. Dementia rarely arrives all at once. It tends to creep in quietly, one small change at a time, so gradually that family members often look back months or even years later and realize the signs were there all along. That is exactly why this video matters. We are going to walk through 10 of the earliest and most telling signs, explained in plain language, with real-life examples that make each one easier to recognize. Stick around, because sign number 7 is one that even experienced caregivers frequently miss, and understanding it early can change how a family responds when it counts most. Before we get into the list, it helps to understand what dementia actually is. Dementia is not a single disease. It is an umbrella term that describes a decline in memory, thinking, and reasoning severe enough to interfere with daily life. Alzheimer's disease is the most common cause, but there are others, including vascular changes in the brain and a condition called Lewy body disease. The reason early recognition matters so much is that some causes of memory decline are treatable, and even when the underlying condition is not reversible, early support can help a person maintain independence and dignity for longer. There is also a broader reason this topic deserves attention. Risk for cognitive decline tends to climb after the age of 65, and family members are often the ones who catch the earliest clues, long before the person experiencing them fully recognizes what is happening. That is part of what makes this list so valuable. It is not written for doctors. It is written for sons, daughters, spouses, and close friends who spend enough time with someone to notice when a pattern shifts. A single odd moment rarely means much on its own. It is the accumulation of small, repeated changes across weeks and months that tends to carry the most meaning, and that is the lens we will use throughout this video. With that foundation in place, let's begin with the sign most people already associate with dementia, even if they do not fully understand why it looks different from normal aging. Memory loss that disrupts daily life. Everyone forgets things now and then. You misplace your car keys, you blank on a neighbor's name for a moment, or you forget why you walked into a room. That kind of forgetfulness is completely normal and usually resolves itself within seconds once something jogs your memory. The type of memory loss associated with dementia looks different. It tends to involve forgetting recently learned information, important dates, or events, and then not remembering them later even when reminded. Consider Margaret, a 73-year-old retired schoolteacher. Her daughter began noticing that Margaret would ask about an upcoming family dinner, be told the details, and then ask the exact same question again less than an hour later, with no memory of the earlier conversation at all. It was not that Margaret was being forgetful in the ordinary sense. The information simply was not sticking. She had also started relying heavily on sticky notes for things she used to remember effortlessly: appointments, medication times, even her grandchildren's birthdays. This pattern, needing to rely more and more on notes or family members for things that used to come naturally, may indicate more than typical age-related forgetfulness. It does not mean dementia is present, but it is worth discussing with a healthcare professional, especially when the forgetting involves newly learned information rather than distant memories. Difficulty planning or solving problems. Some people in the early stages of dementia find it increasingly hard to follow a plan or work with numbers. This might show up as trouble keeping track of monthly bills, following a familiar recipe, or concentrating on a task that used to be simple. What makes this sign distinct from ordinary distraction is the pattern of difficulty. It is not a single mistake. It is a noticeable shift in the ability to organize thoughts step by step. Frank had managed his household finances for over 40 years without a hitch. His wife started noticing that bills were going unpaid, not because Frank forgot to pay them, but because he seemed to lose track of the process itself, confusing which accounts had been paid and which had not, sometimes paying the same bill twice in the same month. Frank, who had always prided himself on being detail-oriented, became increasingly frustrated with himself, though he could not quite explain why the numbers no longer made sense the way they used to. This kind of struggle with planning and problem-solving may be associated with changes in the brain's ability to process sequential information. It is a good example of why family members are often the first to notice these shifts, since the person experiencing them may not fully recognize the change themselves. Difficulty completing familiar tasks. Tasks that were once automatic, driving to a familiar location, preparing a favorite meal, or even managing the rules of a card game played for decades, can become surprisingly difficult in the early stages of dementia. What makes this sign so unsettling for families is the sheer familiarity of the task involved. This is not learning something new and struggling with it. This is losing the thread of something the person has done thousands of times before. Dorothy had played bridge with the same group of friends every Thursday afternoon for nearly 30 years. One week, her friends noticed she seemed lost partway through a hand, forgetting which cards had already been played and asking the same question about the rules more than once. At first, everyone assumed she was simply tired. But the pattern continued in the following weeks, and it eventually became clear that something more significant was happening. Dorothy herself began declining invitations to play, quietly telling her closest friend that the cards seemed to move faster than they used to, even though nothing about the pace of the game had actually changed. Something similar can happen with cooking, a task that often relies on a kind of muscle memory built up over decades. A person who has made the same holiday recipe every year without needing to look at a written instruction might suddenly find themselves confused about the order of steps, forgetting an ingredient entirely, or repeating a step they had already completed. Family members sometimes describe this as watching a lifelong skill unravel in slow motion, which can be one of the more disorienting realizations for everyone involved. Losing the ability to complete a well-practiced task without confusion may be an early indicator worth mentioning to a doctor, particularly when it involves an activity the person has performed with ease for many years. Confusion with time or place. Losing track of dates, seasons, or the passage of time can happen to anyone occasionally, especially during a stretch of days that blur together. In dementia, however, this confusion tends to be more persistent and can extend to forgetting where one is or how one got there. Someone might struggle to understand something if it is not happening immediately, or lose track of an entire season despite obvious environmental cues. Robert, a retired mechanic, once became disoriented on a walk through his own neighborhood, a route he had taken almost daily for over a decade. He could not immediately recall which direction led home, and for several minutes he stood on the corner trying to piece together familiar landmarks that suddenly felt unfamiliar. His son later described it as watching his father look at a place he had known his whole life as though he were seeing it for the very first time. This kind of disorientation involving time and place, particularly when it happens somewhere familiar, could be a sign worth discussing with a healthcare provider, since it reflects a deeper change in how the brain processes spatial and temporal information. Trouble understanding visual images and spatial relationships. For some people, one of the earliest changes involves vision-related difficulties that have nothing to do with the eyes themselves. This can include trouble judging distance, determining color or contrast, or reading. These changes happen in the brain's interpretation of visual information rather than in the eyes, which is why an eye examination often comes back completely normal even as the person struggles. Eleanor, 78 years old, began having trouble with something as simple as pouring a glass of water, frequently missing the glass or misjudging how full it had become. She also started to have difficulty with stairs, hesitating and reaching for railings that were not always necessary before, as though the depth of each step had become harder to judge. Her family initially assumed she needed new glasses, but her eye doctor found no significant change in her vision at all. Because these difficulties can easily be mistaken for a vision problem, it may be helpful to mention any new challenges with depth perception or visual judgment to a doctor, so that the underlying cause can be properly evaluated. We have covered 5 signs so far, and each one on its own might seem easy to explain away. But the next sign is one that often catches families off guard, because it touches something most of us take for granted every single day: our ability to simply find the right word without even thinking about it. New problems with words in speaking or writing. Some individuals in the early stages of dementia begin to struggle with vocabulary. They may stop in the middle of a conversation with no idea how to continue, or they may repeat themselves without realizing it. They might also have trouble finding the right word, sometimes substituting an unusual or incorrect word in its place, calling a wristwatch a hand clock, for example. Helen, a retired librarian who had always been known for her sharp vocabulary, started having moments where a common word would simply vanish from her mind mid-sentence. She would pause, visibly searching, and then describe the object instead of naming it, calling a fork the eating thing with the points, because the word fork would not come to her. Her husband found these moments heartbreaking, not because of the words themselves, but because of how aware Helen seemed to be that something had changed. This kind of language difficulty may be associated with early changes affecting the brain's language centers, and it is generally more significant when it represents a clear departure from how a person has always communicated. Misplacing things and losing the ability to retrace steps. Nearly everyone misplaces an item occasionally, and it is completely normal to retrace your steps and eventually find it. What sets this sign apart in dementia is the combination of 2 things happening together: placing items in unusual locations and losing the ability to logically retrace one's steps to find them again. This is the sign that even experienced caregivers sometimes overlook, because on its own, misplacing an object does not seem alarming. George, a retired postal worker known for his organized habits, began finding his wallet in the refrigerator and his reading glasses in a kitchen drawer alongside the silverware. When his wife pointed this out gently, George could offer no explanation at all, not even a guess as to how the items ended up there. What worried his family most was not the misplaced items themselves, but George's complete inability to walk back through his recent actions and reconstruct what had happened. When this pattern becomes frequent, and especially when it is paired with accusations that others are stealing or hiding items, it may be helpful to bring it up with a healthcare professional, since it reflects more than simple absent-mindedness. Decreased or poor judgment. Changes in judgment and decision-making can be one of the more subtle signs, partly because they often show up in areas of life that are easy to attribute to other causes, like stress or fatigue. This might include giving away large amounts of money to telemarketers, paying less attention to grooming, or making decisions that seem completely out of character for the person involved. Walter had always been famously frugal, the kind of man who reused envelopes and clipped every coupon in the Sunday paper. His daughter was stunned to discover that he had made several large, unexplained donations to charities he had never mentioned before, along with purchasing items from door-to-door salespeople that he would never have considered buying in the past. When she asked him about it, Walter seemed genuinely puzzled by his own decisions, unable to explain what had motivated them. A noticeable shift in judgment, particularly involving finances or personal safety, could be a sign worth discussing with a doctor, since it often reflects changes in the areas of the brain responsible for evaluating risk and consequence. Withdrawal from work or social activities. A person experiencing early dementia may start to withdraw from hobbies, social engagements, or activities they once enjoyed. This withdrawal often stems from an awareness, even if unspoken, that something feels different, and a resulting embarrassment or fear of being caught in a mistake in front of others. It is a quieter sign, and one that is frequently mistaken for simple aging or a change in personality. Ruth had been an enthusiastic member of her church choir for over 20 years, rarely missing a single Sunday rehearsal. Over the course of several months, she began finding reasons to skip, first citing a cold, then fatigue, then simply saying she was not in the mood. Her friends from choir eventually noticed she seemed to be avoiding gatherings altogether, not just choir practice. And when one friend gently asked if everything was all right, Ruth admitted she had been struggling to keep up with the music the way she used to and did not want anyone to notice. Withdrawal like this may be associated with an internal awareness of cognitive changes, even before a formal diagnosis has been considered, and it is often one of the more emotionally difficult signs for families to watch unfold. What makes this sign especially tricky is how easily it blends into ordinary life. Older adults naturally slow down in some social activities as energy levels change, so a step back from one hobby rarely raises alarm on its own. The distinction worth paying attention to is a broader pattern, stepping away not from one activity but from several at once, paired with vague or inconsistent explanations for why. Loved ones who know a person well are often the ones best positioned to sense when an explanation does not quite add up, even if they cannot immediately articulate why. Changes in mood and personality. Perhaps the most painful sign for families to witness is a genuine change in mood or personality. This can include increased confusion, suspicion, depression, fearfulness, or anxiety. It might also involve becoming easily upset in situations that would not have caused distress before, whether at home, at work, with friends, or in places outside of a familiar comfort zone. Arthur had spent his career as a calm, easygoing accountant, someone friends described as almost impossible to rattle. In his mid-70s, his family began noticing sudden outbursts of frustration over small inconveniences, along with a growing suspicion toward people he had known and trusted for years. His wife recalled one particular evening when he became convinced that a neighbor had entered their yard to move his garden tools, something that had never actually happened. These were not simply bad moods. They represented a genuine shift away from who Arthur had always been. When personality changes appear suddenly or seem out of character, it may be helpful to have that person evaluated by a healthcare professional, since these shifts can sometimes be one of the earliest and most telling indicators of an underlying cognitive change. Taken together, these 10 signs paint a picture that is less about any single moment and more about a pattern over time. According to the Alzheimer's Association, more than 6 million Americans are currently living with Alzheimer's disease, and that number is projected to nearly double by the year 2050 as the population continues to age. That statistic is worth sitting with for a moment, because it means nearly all of us will either experience this personally or watch someone we love go through it. If any of these signs sounded familiar, whether in yourself or in someone close to you, please remember that noticing a sign is not the same as receiving a diagnosis. Many of these changes can have other explanations entirely, including vitamin deficiencies, thyroid conditions, medication side effects, depression, or simply the normal, gradual slowing that comes with age. The only way to know for certain is through a proper evaluation with a healthcare professional who can look at the full picture. What matters most is paying attention, staying compassionate, and not dismissing changes simply because they feel uncomfortable to acknowledge. Early conversations with a doctor can open the door to support, resources, and in some cases treatable causes that might otherwise go unaddressed for years. If you do recognize several of these signs in someone you care about, there are a few gentle, practical steps that can make the process easier for everyone involved. It often helps to keep a simple written record of specific examples, including dates and details, rather than relying on memory alone when the time comes to describe the changes to a doctor. Concrete examples tend to be far more useful during a medical evaluation than a general impression that something feels different. It can also help to involve the person directly in the conversation whenever possible, framing the visit around general health and wellness rather than singling out memory alone, since this approach often feels less frightening and less like an accusation. Bringing a trusted family member along to any appointment can provide an additional perspective, since the person being evaluated may not always recall or recognize the full extent of the changes others have noticed. Finally, try to approach the entire process with patience. A thorough evaluation often takes more than one visit, and it may involve several types of testing, including blood work, cognitive assessments, and sometimes brain imaging, before a clearer picture emerges. None of these steps guarantee an easy path forward, but they do tend to make the experience feel less overwhelming for both the person involved and the family supporting them. It is also worth remembering that a diagnosis, if one is eventually given, does not erase the person you know and love. Many individuals in the earlier stages of cognitive decline continue to enjoy meaningful relationships, hobbies, and independence for a significant period of time, particularly when they receive support early. Fear often keeps families from starting this conversation at all, but in most cases, waiting only makes the eventual conversation more difficult, not less. If this video helped you understand something new today, we would love to hear from you in the comments. Have you noticed any of these signs in someone you love, and how did your family handle that conversation? Sharing your experience might help someone else who is quietly wondering the same thing. If you found this information valuable, please consider sharing it with someone who might need it, and subscribe for more videos like this one. We will see you in the next video.